When your head moves forward, four very important and destructive events may be taking place. First, the joints of the spine may become stuck in an open position. Second, when a joint is involved, the deep muscles that surround it can waste away. Third, the discs can move out of position. And scar tissue can also be a major source of pain. As a result, disc problems, pain, and arthritis are commonly found in the neck. In part 2 of the next series, we will briefly discuss these, and we will look at the steps necessary to stop your pain. At the tip of the red arrow, you see a picture of the kind of joint that you have at the bottom of your neck. When these joints get stuck in the open position, they cause that familiar, deep, achy feeling close to your spine. To relieve your neck pain, you must have these joints gently closed. When you hear someone say that they have arthritis in the spine, these joints are usually involved. Just a brief note here, because ribs attach to the spine at the bottom of the neck, they can also become stuck. It is very important to keep the joints moving where the ribs attach to the spine. In fact, many times the pain won't completely resolve unless the ribs are gently repositioned as well. Research has shown us that when a joint is injured or functions improperly, the deep muscles that surround that joint start to waste away. The muscles can become much smaller and much weaker very quickly. In fact, the muscles can become so much smaller that they appear to waste away. Now let me be clear about this. The muscle doesn't disappear. It just gets so small that it barely functions. The result of muscle wasting is that you feel pain and it makes your neck joints unable to hold a normal position. When this happens, you need to do specific exercises to rebuild these small muscles. In fact, some of your pain may linger for years until these wasted muscles are strengthened again. Discs are the pads between the bones that act like cushions. These cushions allow movement between the bones, and this in turn gives us flexibility. This freedom of movement is a wonderful thing, but it can be a double-edged sword. You see, discs can be a source of unremitting pain as well. This is a picture of two discs looking from the top down. Think of the discs in our spine as jelly donuts, because the discs in our spine have a jelly center and a tough outside. The important thing to remember is that the jelly should always be in the center of the donut. Why? Because when the jelly is in the center of the donut, you have no pain. If the jelly pushes against the outside of the donut, you have pain. Simply put, jelly inside the donut, no pain. Jelly pushing against the outside of the donut, pain. In this picture, the person on the left has no pain because the jelly is in the center of the disc where it should be. The person on the right does have pain because the jelly is pushing against the outside of the disc. Simple. It's important to note that the jelly doesn't need to be very far from the center of the disc to cause you pain. Therefore, I always treat the discs of my patients who have neck pain or headaches. While trauma from accidents can cause your disc to move out of position, it's important to remember that poor posture can cause it as well. The word that health professionals use to describe scars is fibrosis. As you can see, scar tissue, or fibrosis, can form in any tissue of the body. Whether it's a scar you can see on your skin, or a scar that you can't see deep in the muscle, the effect is the same. Scars don't stretch, therefore scars make muscles shorter. And this creates two problems. Scarred muscles pull on the joints with increased tension, and this in turn stops the joint from moving smoothly. So scar tissue can be a major cause of your pain and joint stiffness. For example, if you have scar tissue in the muscles of your neck, your muscles are shorter than they should be. These short muscles pull on your neck joints and stop them from moving smoothly, which is one of the causes of your pain and stiffness. In fact, it's common to find scar tissue in the neck muscles of those who suffer from frequent headaches. Scar tissue has four basic causes. The first is trauma, and that's where you hit something or something hits you. A car accident, for example. The second is repetitive motion. Repetitive motion is where you do something over and over again with a part of your body. This is experienced by typists, athletes, students. In fact, most of us do something over and over again, and this causes scar tissue to form. Third, we form scar tissue as we age. It's just one of those facts of life. Our last cause of scar tissue is improper body mechanics. This is where we ask a body part to assume an unnatural position, and usually for a prolonged period of time. Sleeping on your stomach, or holding a phone to your ear with your shoulder, are two glaring examples of improper body mechanics. Both of these cause the skull to move out of position, and headaches are common and usually frequent at this point. Okay, let's review what we know. When your head moves forward, the muscles in the back of your neck start to spasm, and this causes trigger points to form. The jelly in your disc moves away from the center, and this prevents the joints of your neck from closing as they should. As a result, the small muscles in the spine may start to waste away, and this makes the joints in your neck unstable. Scar tissue frequently forms, which locks the motion of the joints. Bottom line, these events can cause spasms, pain, and over time, arthritis. For people who have frequent or severe headaches, they usually have all of these. You must treat all these causes to stop your headaches. A massage is a wonderful thing. It relaxes the muscles, and it feels great. But I find that the muscle spasms and headaches will often return quickly, unless the trigger points in the muscles that cause the spasms, pain, and headaches are deactivated. The jelly needs to be returned to the center of the disc. The joints at the bottom of the neck, they need to be closed. Motion at the base of the skull needs to be restored to release the tension. Scar tissue must be gently treated, which lengthens the muscles and allows the bones to move properly again. And exercises must be prescribed to help the head return to a healthier position. Once these things are accomplished, the muscle spasms calm and the pain decreases rapidly. Even long-standing headaches respond amazingly well to this approach. Do you suffer from neck pain or headaches that seem to be progressing or just won't get better? Do you suffer from a deep nagging ache in your neck and shoulders that builds as the day progresses? Have you given up? Do you feel you'll just have to live with the pain? Have neck pain and headaches taken all the fun and energy out of your life? Then perhaps you should consider a highly effective approach that combines soft tissue techniques with gentle pain-free adjustments. This is the approach I take with my patients. Call and set up an appointment. It'll surprise you just how good it feels to feel good.